Hi, thank you for choosing Integrative Health, where your health starts. Today, we're going to be teaching you, our valued patient, just how to give yourself an intramuscular injection. But don't worry, it sounds a lot tougher and much more painful than it actually is. But first, let's make sure we have all the necessary supplies. Necessary supplies will consist of what the doctor has prescribed, as well as what you can get from your local pharmacy, such as your bottle, the 18-gauge draw needle, the 25-gauge injection needle, a 1 or 3 cc syringe, an alcohol prep pad, a gauze or cotton ball, and a Band-Aid. Next, we want to wash our hands thoroughly as to limit the possibility of any outside cross-contamination between our supplies and our body. Now, we must prepare our needle for injection. By opening and applying the 18-gauge draw needle to the syringe provided, by simply twisting the needle atop of the syringe clockwise, we have affixed the needle to the syringe. Do not touch the syringe hub with your fingers. After removing the small plastic or metal cap exposing the rubber stopper, we will then clean the top of the vial with an alcohol wipe with one left to right motion. We then very carefully insert the tip of the needle into the vial to withdraw its contents until the prescribed dosage is reached. Make sure the syringe does not contain air bubbles by tapping the syringe. Withdraw the needle from the vial, place the vial on a safe surface, and very carefully reapply the cap to the needle. Prior to giving yourself the injection, it is imperative that you switch from your draw needle to your injection needle. Now, with our needle prepped, we must locate the site of injection. The muscle easiest to locate in an unawkward fashion for self-injection would be the vastus lateralis located at your quadricep. This muscle can be located by placing one hand on your hip while in the seated position and one hand just above the knee. You're going to want to inject the upper third and outer third of your quadricep. Once we have located the injection site, it must now be cleaned. Take the alcohol wipe and moderately scrub the site and let it completely dry. The injection will tend to sting if you do not. This also allows for the site to be as clean as possible. Do not blow on the site to speed the drying process. Inject the medication by taking the pre-prepped syringe in your dominant hand and, as if we were throwing darts, administer the shot in a finessed, quick penetration into the injection site, submerging the needle. With your free hand, stable your syringe. With your dominant hand, we will now push the contents into the muscle with the syringe plunger. This is done while not pressing the needle further into the muscle. In a steady and straight motion, withdraw the needle from the muscle and quickly cover and apply pressure to the injection site with a sterile gauze or cotton ball. Do not recap the needle. Simply discard the needle into your biohazard sharps container and do not throw the needle in the trash. Although it may take a little extra bravery and confidence, self-injection is the perfect way to stay on schedule if you are unable to visit us personally. Remember, if you have any questions, knowledgeable laboratory staff is always available, and for personal lessons, schedule an appointment. Thank you very much for visiting IH, and have a wonderful day.